Well, aloha and good morning. Thanks so much for tuning in and starting your week with us. It is a new week. It is a new month, February 1st. This is Spotlight Hawaii. I'm Ryan Kalei-Suji, joined by Yanji Denise. And today we will be speaking with Lieutenant Governor Josh Green on the state's efforts to continue the vaccine rollout here in Hawaii and a few other matters related to COVID-19.
Yeah, we're always excited to talk to Dr. Green. He, of course, spearheaded the Safe Travels program, and he is handling the vaccine rollout for the state. Those two going hand in hand in the news right now. We want to start, of course, with the vaccine. Lieutenant Governor, if you could start us off with where we are in terms of vaccination numbers and how that effort's going.
Thank you. Thank you for welcoming me back. So we're 151,558 shots have been given. We're now accelerating to the point where we can do over 10,000 shots a day, over 50,000 a week. And you can see how that will pile up really nicely. We have 243,800 doses in state by midweek this week. And so we're really accelerating through our supply and getting it out best we possibly can equitably to all of our state based on population. So we're rocketing upward. By the end of February, I expect we'll have 350,000 doses given. And if we can get Johnson & Johnson approved, which I'm almost certain it will get approved, it gives us another arrow in our quiver to go after COVID. So all of these things are extraordinary. We're quickly advancing ahead of most other states. The data comes in a little slower for us, but that's a fact. We are doing better than most. And I'm very intent on getting us through the 1B category as quickly as we can. That's 75 plus age. Also, those who are front-facing essential frontline workers. We do that, and we become a lot more protected. A lot of this ties into policy that we'll talk about, but at the same time, we've been fortunate because people have been such great partners. We've seen our counts drop. We're down to 90.7 cases per day on average over the last 7 days. Today's count was 90, and our positivity rate's now down to 2.13%. It's been dropping really steadily, and on Oahu, the number is at 2.47%. So you see that these are the things that we have to do. We've also got our hospital counts down into the 60s, so the number of people in the hospital with COVID. So all these trends have been great, although not without a lot of blood, sweat, and tears from Department of Health and General Hara and their team and everybody out there. My goal, and I'll wrap up this initial statement, my goal is to get us vaccinated as fast as possible, get into 1C where we get as many 65 to 74-year-olds also vaccinated. And we use this analytic to open our state up. By getting vaccinated and then only allowing individuals to bypass any of our safe travels by also being vaccinated, you see how that safety goes hand in hand. I do think it will become the national standard before long. We're still waiting on some approvals from Department of Health and the Gov, but the proposals have been made. The national folks believe this is going to likely be something we can do. And Hawaii is poised to emerge faster from the COVID lockdown than any other state. But we have to do it safely, and we have to protect our kupuna.
We've got a lot of information there to unpack. We want to start off with something that the governor had mentioned last week, just saying that the state has a capacity to distribute. The biggest problem was just getting the vaccine here on island because of the demand nationally and with the slowdown that they're seeing on the national level. What are you seeing in terms of the rollout, in terms of what is being provided to the state locally from the national level? And how are those numbers expected to increase, you think, over the next few weeks?
Great question. So last week we got 32,000 doses in. This week we got 40,600 doses in. So it's boosting. The Moderna vaccine numbers are about to go way up. We're about to get a much bigger supply, we're told, on Moderna. And then when the Johnson & Johnson is added, we can again super surge it. It would be great to get another 20 or 30,000 doses per week. We can do 80,000 shots a week now. We are capable of doing that, yet we're only really going to do about 50,000 because they haven't given us enough to keep up our regimen. Remember, of course, people have to get two shots for the Pfizer, 2 shots for the Moderna, one 3 weeks apart, one's 4 weeks apart. But that's going to rev up. I think that the Johnson & Johnson is going to get approved within 2 weeks, and then we'll start getting doses right after that. Then the AstraZeneca. And before you know it, if all of this falls into place, which I'm almost certain that the Biden administration wants to see all this stuff fall into place, we could be doubling our capacity to vaccinate people. And so instead of doing 200,000 people a month, we could, if everything goes perfectly, double that. And now you're talking about getting through our population really quickly. That's why when I suggested we could get to herd immunity sometime this summer, I mean it, because I do see the tea leaves in the way they're falling. And if people are patient, we'll get there.
I want to ask you about that Johnson & Johnson vaccine. We've seen reporting over the weekend that the efficacy does not nearly match that of the ones that are available right now. So just as a layperson looking at that, I would think, okay, well, I prefer to get Pfizer and Moderna. Do I have any say once that's approved? And if, why should I take what I can get as opposed to holding out for the others?
Great question. Anyone should choose the vaccine they want. And also, if they don't want to get vaccinated at all, although I strongly recommend you do, I got vaccinated as a healthcare worker, you should take whichever one you choose. Now, the Johnson & Johnson is only about 66% effective, although it was higher than that in the US and lower than that in Europe. And that's to totally create immunity for a person. However, it did have a big benefit, which was, I think it blocked as much as 95 to 100% of severe hospitalized or near-death cases. So therefore, what you would expect would be we would use the Moderna and Pfizer on, first of all, anyone who chooses them, but especially on our Kupuna or people who have a high mortality rate. And a lot of people may want the Johnson & Johnson shot for a couple of reasons. Number one, it's just one shot. And that's a big difference. It's a really great thing to be able to get just one shot. And if you're very low risk, let's say we get to when we get to stage 2, which is all people that are any age without any healthcare considerations, maybe even children, the main thing you want to do is prevent any hospitalizations or severe illness. One shot for that class of people who are already doing very well may very well be their first choice. So it's just another option. In a perfect world, all of these shots would be 95%, and all of them would be as simple as the Johnson & Johnson. But there are just going to be several options, and people should choose what they feel they want best.
I want to bring in a question here. Lake Maddow asking, will vaccinated travelers get exempt from testing? We know that you had mentioned in your opening statement that you've put forth a proposal to change the rules of the Safe Travels program, and with those who have been vaccinated being able to travel more freely into the state. But we also heard from the governor last week saying that he would wait for guidance from the CDC to make a statement on vaccination and travels. Can you talk to us about what was included in that proposal, and how do you foresee this sort of laying out in the next few weeks?
Yes, I'm very optimistic that this will become our policy once we get a little more information from the federal government. I've had incredibly positive feedback from the mayors on this matter and Department of Health. So we will wait their formal recommendation, but my proposal is the following. When we finish the majority of 1B individuals, which is that's 150,000 individuals, including healthcare workers or 1A, Kupuna nursing homes, and 1B, which is 75 and older, and our essential front-facing workers, then we can begin to open up. And instead of having to go through the Safe Travels pre-test program, people would be able to travel freely if they are fully vaccinated plus 2 weeks. The extra 2 weeks so your immune system has had time to create the antibodies to fight it. All of the data has begun to point that we will be able to be safe with a vaccination plan like that. It's called sterilization immunity. We still have a little bit more to hear, but the buzz right now is that we're moving toward this policy, although we have to get the final word, of course, from the gov and the mayors. I think we'll have something to announce in the next 10 days. The ideal circumstance would be able to do that, would be for us to be able to do this, because let me be really clear about why it will be safer. First of all, no one else is doing as much as we have been doing with these kind of test protocols, safe travels and what have you. But it's another layer of safety. It doesn't take away the Safe Travels program for those who just don't want to get vaccinated. They'll still go through the same process. But if people get both shots and have 2 additional weeks, their immunity is over 94%. It's 94.5% for Moderna, 95% for Pfizer, vice versa. So those will be immune individuals, very low risk that they carry the virus, and we'll still check them for temperature, the questions asked, and so on. But then they wouldn't need that test. So they can plan their trips more appropriately. We can plan our travel to be reunited with our family members more easily, whether we're going to visit our loved ones like we were talking about before our show, or they're coming to visit us from the mainland. This is a win-win for us in Hawaii in every way. and we will also have vaccinated our most vulnerable people. So as we move through 1B and then through 1C, in my opinion, we should really lift all of the extra travel testing rules, because this is even safer than that. We'll still have plenty of tests available, but it also opens up some more testing we can do in-state, whether it's at schools or businesses or what have you. We're going to get through a lot of vaccinations between February, March, and then even April. I mean, a huge majority of our people that want it will be able to take the vaccine by then. So it's just timely, and we do have to get our state back on track. We have to restore some hope for our economy, because it's only a matter of time until desperation will set in. And for some, it already has set in. So that's why I'm pushing these proposals. I think they're going to approve them, though.
At 10:32, Linnell Marie just had a question. What about the variants? Can you tell us a little bit about what variants might be here in the islands that we know of? Of course, there could be some that are undetected. And when we think about the efficacy of the vaccine, how does that line up with the variants that we're seeing?
Great question. So we've had some a very small number, I believe 2 cases of the Denmark variant. That variant also is really kind of caught on in California, and I'm sure that's how we caught it, because we have not had travelers from Denmark. As you know, there's a lockdown from Europe, but they have gone to other places, and that variant is there. It's a little more infectious, but it's not more lethal. We've not, to my knowledge, had any cases of the B.1.1.7 Great Britain variant. That's the very infectious one. Again, it's not more lethal, but if you catch it and you're elderly, it's potentially lethal under any circumstance. We've also seen lots of testing of these genetic, the genomes or the genetics of these viruses by our Department of Health. So we're monitoring it real closely. Now, all of the variants appear to be blocked by the vaccine, although the South African variant, which we've not had cases of, may be more problematic. And so it's incumbent upon us, for those who believe in vaccines, to get vaccinated as soon as possible, as soon as I can, and Department of Health and Public Safety and everyone else can vaccinate people. It's a good idea to get it, because we don't know when these variants are going to land in Hawaii. They eventually will be in every corner of the world on some level. So we're going to rely on, for safe travels purposes, we're going to make sure people get vaccinated on the mainland to give us extra buffers of security and safety. And we're going to have our own people vaccinated, hopefully 70% or plus, so we get herd immunity in our state, so that whatever variant comes, it won't really be meaningful or impactful. This is a virus that over time is going to keep spreading across the globe in pockets, though it will settle down in late 2021, because the option of having a vaccine is being kind of gobbled up by people.
Another question that we have from Glenn Moriyasu saying Maui COVID counts are still high. Why isn't more vaccines coming to Maui? How was the decision made on how many vaccines are sent to the neighbor islands? Is it based on population? How are you leading sort of the efforts to get this out to communities like those on the neighbor island?
It's made purely based on population for fairness purposes. Maui had 20 cases today. Their average daily count was 18.3 count per day over the last week. These are unbelievably low counts. I know that Maui, and they deserve to be concerned, Maui had a slightly higher rate than other places, but not compared to anywhere else in the country. And so it's being done as fairly as possible. Also, there's a desire to not show favoritism, because you can imagine if favoritism were shown, and Oahu, which tends to have a lot more input from government and so on, certainly much larger numbers, it could overwhelm all of the neighbor islands, which is where I'm from on Big Island and where this person's calling from, Maui. And then there'd be no vaccine at all for the rural communities or the neighbor island communities, because they would be overwhelmed by the demand of the 1 million people that are on Oahu. So it's got to be done fairly. So it's done based on population. The hospitalizations have dropped quite precipitously. I will share with you that the number of people in Maui Memorial Hospital is 14 individuals with COVID right now, which is a pretty small number. It's half of what's at Queens. So we're trying hard to knock the virus down, but we can't show favoritism one way or another. If there is an outbreak, though, like in a housing project or something, the Director of Health will authorize quick vaccination of that small cluster to stop it. And that could be a housing project. It could be an institution like a long-term care facility. Lots of different options for the Department of Health.
At 10:39, Andrea Novak says, how about the hotel workers? When do we get vaccinated? We are front-facing workers. So what's kind of difficult for some people, I know I myself am in this boat, where you don't really know where you fall into. The category of essential worker is so broad. If you look at, I was looking back at some of the governor's initial orders, and people who were exempted from certain activities, they could be in real estate, they could work in certain retail, they could be journalists like Ryan and I, and they are quote unquote essential. How do you know where you fall in those categories? Is that something that your doctor will determine, or who's actually making that call once we get out of, I mean, it's very clear, healthcare workers, of course, emergency workers, of course, people over 75, but once we get into the broader essential worker category, how do we know when it's our turn?
Sure. So massive announcements should be forthcoming. Hotel workers are 1B. The prioritized, quote unquote, prioritized healthcare folks and first responders were at the top of 1B, but hotel workers are in 1B, and there's some method to this madness, and that is that as extra travelers come, we don't want, even if they are vaccinated, we don't want extra risk of any kind to be spread where there's a lot of activity. Same can be said of grocery workers. They are also in 1B, and some of this is being clarified as we speak. In fact, at 5:30 this morning, the co-chair and I on this subcommittee were talking and sharing our new memo for the director of health. So there's more expansive guidance. People in the industries will reach out to their own folks. So the hotel organization, like the Tourism and Lodging Association, will be able to share that with all of the hotels, and they'll make the determination for which individuals are most front-facing, less than 6 feet apart from people with some frequency, and could catch it. Other people that are in that 1B category, transportation workers, people that have to work at the airports, individuals that work in the harbors that are essential because they have to keep the harbors open. So there's lots of subgroups there, but the total population in 1B of essential workers is not too large. It's about 50,000 in that category, and then those who are essential workers but not front-facing as much disease risk end up in 1C. So that'll get clarified by each industry. The good news is by ramping up vaccinations in general, we can kind of stream through 1A, B, and C without too much difficulty. That'll be now accelerating because these extra vaccines will come online. I can tell that it is frustrating for people, but the general premise right now is we're vaccinating our kupuna and those who care for our kupuna. So like anyone who has to keep the energy grid together, to get food for people, to provide health care for those who are most vulnerable, also we're getting vaccinated. Then the list expands and expands. And the last group to get vaccinated, last two groups, will be people who are totally healthy and young, and then children once that's approved by the companies and the research is done. If we play our cards right and these additional vaccines come online, which they will, by midsummer, everyone will have been offered a vaccine if they would like one, and much sooner. You're talking about February, March, April for anyone who's kind of in the essential workforce.
I want to stick on that topic of Kupuna because there is some discussion and questions coming in from how do we categorize the age limit for those who should be receiving this. Of course, some are saying in other states, 65 and older is the requirement. Here in Hawaii, we're saying 75. How is the determination on the age specification of Kupuna, and when would we see that level or that number dropping down to those who are maybe younger?
So we started with the initial federal advice, which was 75 and older, and then they moved the goalposts a little bit on us a couple weeks later. It was purely based on the amount of vaccine that we had coming into the state. If you look at the first couple weeks, we got a lot less vaccine. We got like 3,500 doses in the first week, and then it ramped up a little bit and a little bit. But we have 109,000 kupuna who are 75 and older, and then we have 148,000 individuals that are 65 to 74. So it was purely based on the amount that we had available. And I would mention that everyone in the 1B category, if anyone is older, we're erring on the side of getting those individuals. If it's like a 67-year-old individual that's still working at a hotel or doing any number of jobs actually that are in these categories, first responders, that those folks would get kind of a preferred place because they're also older and essential workers. I think that we will be moving pretty rapidly to the 1C category just in the next few weeks. Wouldn't be shocked at all if that's our theme for March. And all of the individuals in 1C that are 65 to 74 will be prioritized there. So you can see as just February, March, April kind of come and go, we're going to be moving quickly into that 65 to 74 category. If we had just put everybody in and we had a category from 65 up right off the bat, it wouldn't have changed anything, except that it would be that much harder for 75 plus people to get vaccinated, because they're at a small disadvantage because they don't use as much technology, can't sign up as easily. And so the basic rate of risk is so high if you're 75 plus for hospitalization or mortality, dying. We wanted to make sure we focus there more than anything.
This is a similar question, but on the chronic health conditions. How do you know if you have a qualifying chronic health condition? And is that something that, I know that in some states it's basically the honor system. You say, yes, I have this, and you can qualify. Or is here in Hawaii, is this something that your doctor will make the determination? How do we know?
It wouldn't be bad to reach out to your physician, but I do believe it will be the honor system. There's a lot of privacy issues here, and it's very difficult to ask someone, and shouldn't be asked, do you have HIV/AIDS, for example? Do you have leukemia? Do you have out of control diabetes, putting you at a great risk? So we will have to have some of the honor system. And for the most part, a huge majority of people will be honorable about that. There may be some cases where people will perhaps hop the line, but I think it's going to be pretty rare. And frankly, individuals who might otherwise hop the line, they're probably going to be more inclined to get the simpler vaccines, like the one-shot Johnson & Johnson. That's a shot I would not really recommend for someone who's got more severe risk and has severe chronic disease, and should get the 2 shots, which are, a lot more effective. So there will be some honor system going. Of course, you can't fudge your age, not easily, but I think you can rely on people's honor. And again, once we can get up to 300 or 400,000 shots a month, it will be a moot point. It will be mass vaccination sites plus pharmacies plus your doctor's office eventually. So it shouldn't be that hard. Keep in mind that we have 1.4 million people. We will probably be lucky if we get to 900,000 individuals vaccinated total, which is somewhere between 1.6 or 1.5 and 1.8 million shots, because the Johnson & Johnson is just 1 shot. So not everyone will require 2 shots. Once we're doing 400,000 vaccine shots a month, look how fast you get there. Almost faster than you can ask people to come in, because they have to take a 3 or 4 week pause between their shots. So I think that it's going to be a spring of vaccinations for people. I know that the Biden administration is going to make this their moonshot, their top priority out of the gate. And it comes to all of mankind's benefit that this is what everyone's focused on, because we can stop COVID by this summer with the vaccination process.
I want to pivot just a little here and talk about the reopening of our economy, and maybe loosening some of the restrictions that were placed in the current tier system here on the city, on the island of Oahu. Mayor Blangiardi expressed some interest and made some comments last week about looking to reopen bars, which we know under the current tier system is listed in tier 4. And he's looking at allowing bars to open, as well as maybe including the playing of sports for students, youth sports and group sports. Wanted to get your thoughts on that. Do you think that this is something that we are ready to move forward with, given the circumstances that we're currently under?
Well, we're certainly getting a lot closer to being able to do big openings. We only had 57 cases on Oahu today. And with a 2.13% positivity rate statewide, our numbers are coming down into the place that Oahu wants to be. I don't like second guessing the mayors. They get mad. I learned that from other mayors in the past. And so I really want them to make their own decisions. But I will say that I have proposed, once we get through the 1B, that we can move universally out of some of the more restrictive tiers. I absolutely think that once we've gotten past 1B, we should open up high school sports. Bars have taken it on the chin. Their industry has been closed, and we should provide more support for any industry, more subsidies if they have to pay their rent, pay their liquor license, pay all these costs that any number of industries have had to do. So I'd like to see them open. But that's why when you get through the high risk groups and they're vaccinated, you don't have as much to worry about, because even if there are cases, the cases will be in 20 to 30-year-olds who don't end up sick enough to go into the hospital. They just have to take 10 days of quarantine away from society. So that's a long way of saying, yes, I think that we can relax the tier systems in the coming weeks. I think that the mayors need to to ask the Gov and vice versa. And I don't think it's my place to get in between those two important groups. But my feeling is that as we finish 1B, we'll be fine. We'll be basically safe as a society. And when we do the additional 65 to 74-year-olds, I don't really fear COVID then as a society any longer. So that's when pretty much any gathering that you want to do should be considered.
Wait, I want to get some clarity on that. So you're saying, and when are we projecting to get through? What's the threshold for you to say that any gathering can be considered? Can you go over that again?
My personal feeling is that by about May 1st, at this rate of vaccinations, we will have vaccinated all of 1B, all of 1A, of course, which is virtually done now, and the majority of 1C, which will be elderly individuals 65 to 74 and those with chronic disease. So now you will be left only with people of minor risk. And we will also have the extra protection, presuming that the plan I've proposed goes through, and it's very likely, where people who come to Hawaii will have that additional benefit of being immunized before they pass through the Safe Travels program. The strong majority of people will be in that category. So come May 1st, when we're that safe, we should really be thinking about having large events. Now, we should still do it smart. We should still have masks. We should have people, we shouldn't have them huddled together like sardines, but we will be very safe then as a society. And those who remain somewhat vulnerable are not very vulnerable at all from a healthcare standpoint. They may be vulnerable to catch it. You're talking about 30-year-olds that otherwise have, very little risk of getting severely ill, utterly low probability. And even then, we'll be seeing the earliest parts of herd immunity because we'll be over half of our population vaccinated. Remember, there's about 400,000 people in the 1C category. So if you look at the analytics on this, you got 50,000 people in 1A, you have 150,000 people in 1B, and you have about 400,000 people in 1C. When you get through the majority of these categories and you land on May 1st, your society is pretty well safe. And so I hope sometime around then that the mayors have the opportunity to petition for much larger events like weddings. And I don't know if you want to have giant football games, but certainly high school sports long before that should be considered.
And that would also include, that when you say May, I'm thinking graduation season. Could you imagine people getting together for potlucks again, people gathering in restaurants? But you're also saying that is somewhat adjusted. You still would advocate for masks. I mean, what does that look like on a day-to-day level?
Masks look like a reality for us through the better part of 2021. For one thing, even though I did espouse a belief that people will go in the honor system for the vaccinations, I know a lot of people that will say, hey, stop bugging me. I got my vaccine. I don't need to wear a mask. And so I do think people should still wear masks out when around others in public. But I think those rules will get relaxed once we get herd immunity, which will come surely by the fall. Yes, a large part of why I'm pressing so hard and why I'm such a pain in the neck on this for some of my colleagues is because I think that we have to be careful about missing additional societal-wide milestones like graduations this coming year. So if we can get our society vaccinated for the most part, and we can still be somewhat smart by wearing masks if it's a graduation party and what have you, we'll be safe. And even if there are outbreaks, it won't be among our kupuna. And that's very important because you can see our hospital numbers have already begun to decline. Imagine how low they'll be once most people who are vulnerable are vaccinated. So that's my optimism, and I think it's time we restored hope for our society in a much broader way. And that's kind of the linchpin of why I'm pushing for this policy, as long as we can do it safely. I don't want people to think we're going to rush. If we push through the vaccinations as we can, we'll be safe.
I want to bring in just one more question here as we wrap up. Armando asking, will international travelers be allowed to come here if they receive the vaccine in their own country? This is similar to questions that we saw earlier during COVID about testing and how we would deem to qualify what tests fall under the Safe Travels program. Once we get to the vaccine level, how will you make that determination between what vaccines are allowed to be considered exempt from the Safe Travels program that we've established?
Amazing question. And we've been addressing this. I think international travelers will probably be last on these lists to travel. I think the mainland travelers from the CONUS, the continental United States, will come sooner. But we're all using pretty much the same vaccines, mostly Pfizer, Moderna, and now Johnson & Johnson and soon AstraZeneca are the main vaccines. We have some cautious optimism that everyone will be able to vaccinate their countries, but some will be slower than us, for one thing. And also, there is the question of some of these variants. And so I think that international travel from high-risk areas will be later down the timeline on this proposal. I call this kind of like Operation Vaccination Shield. We put a shield over ourselves by only letting people get vaccinated or having safe travels to come here. But international travel may be a little later. I don't believe they've seen big surges of any of the dangerous variants in Japan, though, and I'm optimistic about that. But these are kind of more analytical questions for our Department of Health. Overall, we can get out of this COVID crisis in the summertime if people continue to be patient and we continue to vaccinate all that we can. And I'll tell you, special shout out to Director Char. She's really been supercharging a lot of this work with her team and General Hara on behalf of the governor. They're making this possible. And now that the administration is going to cover some of our extra costs with National Guard, give us already a 16% bump in vaccine available and a willing population, we're going to come through this really better than any other state. Just knock wood that we don't have any surprises along the way with the virus.
Okay, our time is wrapping up. I did want to ask you one final question, and that was on Thursday. There was a survey that came out, and again, this is a survey that came out based on people in November and December before people actually started receiving the vaccine en masse. But it did show that 50% of Hawaii residents would probably pass on the vaccine if given the opportunity. For the picture that you're painting with us being able to have graduations and restaurants and weddings, all of those things, we need to get to that 70–80%. So what do you say to people who still have some reluctance, who may be part of that half of Hawaii surveyed saying, you know what, I'm going to take a pass or I'm going to wait?
I say it's safe. I vaccinated myself. I mean, I was vaccinated. When I've been giving talks to hospitals, which I do day in and day out, their numbers go from the 50 to 55% vaccine rate to about 75%. Once they know that, number one, it's been safe. We only had, I think it was 21 severe allergic attacks out of 1.89 million vaccines given. It's not like it never happens, but just with a little bit of good health history. In other words, if you've had a severe allergic reaction, don't get the vaccine unless your doctor approves it. It can be done totally safely. So I know that we're going to get over 70% of people ultimately vaccinated. The question is just how long will it take? I think that it's normal for people to be reluctant and a little bit suspicious of something that's accelerated like this. That's okay. But I'm willing to continue to speak out on behalf of vaccinations for those who don't have some kind of spiritual or psychological opposition to them. If you really don't want to be vaccinated, don't get vaccinated. No one's going to force you. But for the good of society and humanity, we have to stop these kind of outbreaks. And I think Hawaii will keep leading the way. I know that many of our people get vaccinated once they've heard through the coconut wireless that it was okay. That's how we communicate. That's what we like to do. And so after half the people have been vaccinated and they realize, hey, life is better, they're more free to move around, it's easier to avoid getting sick, then the next 25% plus will come along and be on board. I'm very confident about that. But again, it's not the kind of thing that I or anyone else should force a person to do. If they don't believe in it, that's okay. But ask around, talk to your aunties, talk to your brothers and sisters, talk to your dad, talk to your mom. And if they went through it and they were safe, then consider getting it yourself.
All right, Lieutenant Governor Josh Green, a lot of information there on the vaccine. We really appreciate it. We know that there's a lot happening there, and we look forward to, as you said, more information to come in the next few weeks about this vaccine rollout and for more availability for the rest of the residents of Hawaii. So thank you so much for taking time this morning.
Thanks for having me.
Aloha.
Wow, Ryan, you know, I really had to stop him there when he was laying out that picture, looking at May already for the kind of opening that, frankly, I did not think would be possible for the rest of this year. But the picture that he is painting of where we could be if we get enough vaccine is something more sort of optimistic and positive, and I think that I've heard from any leader in recent memory.
Yeah, and as he said, these numbers that we're seeing in terms of the people that are getting the vaccine will likely and will go up as the availability comes online. He spoke about Johnson & Johnson and that approval and how that will help with the one shot that is needed with that vaccine. And so he's confident that as more vaccines become available and able for the state to get out shots into the arms of residents, that he's confident that these numbers and the availability to have flexibility in some of these rulings that were put in place will sort of begin to ease up.
Yeah, and he did talk about expect an announcement within the next 10 days. It sounds like they're working behind the scenes on modifying the Safe Travels program to allow, the proposal that he laid out last week would allow for those who have verified vaccine 2 weeks out of the second shot to be able to come here and bypass that test. So he said, expect some modifications to be coming. I know that they're working on that behind the scenes. We'll keep on him for that. He also did mention Dr. Char. We're going to have Dr. Char on Wednesday. So we know that this audience that we have with us this morning is particularly engaged on the vaccine issue. And we're going to be diving in even deeper with the Department of Health Director Libby Char about her efforts. And also asking, because the Department of Health is really where those vaccines are going and they determine who gets what, these questions about neighbor islands and even about, certain communities here on Oahu. I saw one of the comments saying, why are those vaccine centers in downtown in Honolulu? Why are they now not out on the west side and what have you? So we will be talking about equitable distribution with her as well.
And beyond just the vaccine, also about where we're at with the virus. We know that there have been, of course, efforts that have been ramped up with contact tracing, getting an update on where they are with that, what they're noticing about what they're seeing in the community in terms of its spread, and how the Department of Health is making and taking efforts to ensure the safety of the residents, especially with talks of these new types of variants that are being found throughout the country. So all that will be coming up on Wednesday with Dr. Char.
Yeah, that's right. And then on Friday, we're going to be switching gears. We're going to be focusing on Aloha Stadium. A lot of changes happening to that community and to the stadium itself. So we'll be talking to 2 state representatives about what's in store for that area.
That's right. Looking forward to that conversation. Again, thank you so much for tuning in and being engaged. A lot of questions and comments that came in this morning. Always seems to be the case with the Lieutenant Governor, and we try to get through as many as we possibly can because we know that all of you are also have a lot of questions about the things that are impacting your families and your community. So we encourage you to continue to share this video, like this platform, and we'll be right back here on Wednesday with Dr. Char at 10:30. Aloha.
Aloha.